Welcome to the Ingham Health Plan Enrollment presentation. During this presentation, we will go over what the Ingham Health Plan is, who we cover, how to qualify, and how to get enrolled. The Ingham Health Plan is a community-sponsored program that helps uninsured people get healthcare services. The mission of the Ingham Health Plan Corporation is to act as a vehicle to provide access to organized systems of healthcare and improve the status of the uninsured. One important thing to note about the Ingham Health Plan is it is not Medicaid and it is not insurance. Members of the Ingham Health Plan fall into one of the 5 eligibility categories listed below: are non-citizens or lawful permanent residents who have not completed their 5 years residency, applicants with limited Medicaid coverage, which includes spend down or ESO, applicants with a marketplace exemption letter, applicants over 138% of the federal poverty level who did not enroll in a marketplace plan or other comprehensive coverage through an employer or spouse parent's employer, applicants who have applied for Medicaid, Medicare, or a marketplace plan, but their coverage is pending or has an effective date more than 30 days from their current IHP application date. Just as a reminder, applicants must meet income and residency guidelines to be eligible for Ingham Health Plan. In order to be eligible for the Ingham Health Plan, you must live in Ingham County, have an income at or below 250% of the federal poverty level. You can see a full list of our FPL on slide 12 for reference. Applicants cannot qualify for comprehensive insurance, including Medicaid, Medicare, or the Healthy Michigan Plan, and are required to pay a $20 yearly administrative fee. The next 3 slides are going to go over what the guidelines are for residency and household size. Verification of residency is required at the time of application and must be submitted with application. Applicants may provide any of the following as proof: a valid driver's license or identification which provides current name and address, recent mortgage, lease, or rent statement, the voter registration card, identified as an Ingham County voter, recent paycheck, stubs, or other income documentation with applicant's name and current address listed, and any mail dated within the last 30 days that has the applicant's name and current address. Who is considered an Ingham County resident? A person is considered a resident if, at the time of application is completed, he or she lives in Ingham County for any other purpose other than a vacation, even if he or she has no intentions on remaining in the county permanently or indefinitely, lives with a relative or unrelated persons, lives in a halfway house, treatment center, or supervised public or private shelter in Ingham County. Who makes up a household? Related persons living together is your taxable household, and this could include applicant's spouse, applicant's dependent children, must be related, unmarried, and under the age of 19 only. And unborn children are considered to be dependent children and should be counted in your household size. An unmarried couple with a common child all living in the same household are considered a full household. So for example, if you have an unmarried couple who has one common child together and they're all living in the same household, you would be considered a household of 3. The next 3 slides will go over income, guidelines, and requirements. The Ingham Health Plan uses gross household income to determine income eligibility into the program. Assets are not considered when determining eligibility. Countable income includes earned income, and this is income received from another person, organization, or from self-employment. Unearned income, which is income received from a rental property, workman's comp, alimony, SSI, or RSDI. Unearned income from a dependent child or spouse, such as SSI or child support. One thing to note is that earned income from a dependent child should not be included. Verification of income is required at time of application. Proof of income must be recent, and that is dated within the last 30 days. Applicants may provide any of the following as proof of income: recent paycheck stubs, either 4 weekly or 2 biweekly, income verification or denial letter from the Department of Health and Human Service, must be dated within the last 30 days. Other statement of income from employer, must be on professional letterhead and have the number hours of worked and rate of pay. Social Security statement benefit on behalf of your spouse, yourself, or a dependent child. Account statement or other statement of unearned income. An example of this would be child support. And most recent tax forms, only if the person is considered self-employed. Slide 12 shows our current 2021 federal poverty level guidelines. This shows you Ingham Health Plan's income requirements based on household size. When a person applies and is approved for the Ingham Health Plan, they are assigned to a participating primary care doctor's office at the time of enrollment. This primary care doctor is responsible for coordinating specialty care. Once per calendar year, members can ask to be transferred or reassigned to another participating doctor's office or medical clinic in the community. The next few slides are going to go over benefits that are covered under the Ingham Health Plan and some services that are not covered under Ingham Health Plan. This slide goes over some of the main services that are covered underneath the Ingham Health Plan. Primary care, urgent care, and specialty care visits, outpatient lab radiology, physical and occupational therapy. This does have a limited benefit and does require authorization. Members do have access to get up to 20 visits per calendar year. Most immunizations, vaccines, infusion, and injectable medications. Radiation therapy, any eye exam and testing that is considered medically necessary. Allergy testing, shots, and serums. Prescription medications listed on our formulary. And the Ingham Health Plan does have dental coverage for our members through the Delta Dental EPO program. If you would like to see a complete list of our full benefits, you can go to www.ihpmi.org. The Ingham Health Plan coverage and copayment schedule is listed below. The Ingham Health Plan has a $5 copay for office, specialty, and urgent care visits. There is also a copayment due for prescription medications, $5 for generic and $10 for brand name. Our Delta Dental EPO plan also has copayments associated with dental services. These do vary and would recommend you checking with your dental provider before services are rendered. Services that are not covered under the Ingham Health Plan are listed here, and those are emergency room services, inpatient hospitalization, ambulance, chiropractic, any routine vision services, chemotherapy, dialysis, and medications not on the Ingham Health Plan pharmacy list. This is not a complete list. For more details on this, please visit our website at www.ihpmi.org. The next several slides will go over how to enroll in the Ingham Health Plan. To enroll in the Ingham Health Plan, please visit www.ihpmi.org/IHP_enrollment. Please make sure to have all enrollment documents ready to upload. And if you have questions about enrollment, please contact Angie Semeska at the email listed on this slide. Once you've navigated to the web address listed in the previous slide, please click on the tab at the top of the page that says Enroll in IHP. Once you've clicked on the link to enroll in IHP, you must click on Online Application, and this will take you to our online application. The Ingham Health Plan enrollment application now has a save feature. This allows applicants to come back at a later date and finish their application. Applications must be completed within 2 weeks or will need to be restarted. Applicants who choose to use the save feature will be required to create a username and password within JotForm. Once you have navigated to our application page, up in the right-hand corner, you have the option to choose different languages. You can choose English, you can choose Spanish. If you speak another language or need the application in a different language, we do have phone interpreters available for help. Next, the applicant will need to answer a few eligibility questions about residency and income. These questions are to make sure the applicant lives in Ingham County and has income within Ingham Health Plan's income guidelines. There is a zip code lookup tool attached to the application that will allow the applicant to search and verify that their address is within Ingham County. A separate IHP application is required for each household member seeking coverage. The applicant will now enter all personal data as applicable. The information that has an asterisk next to it is a required field. Something important to note is that if an applicant has a Social Security number, it will need to be entered. If the applicant does not have a Social Security number, this can be left blank. When you get to the section of the application that asks you to select a primary care office, you can do this by clicking on Review IHP Participating Provider Office List. This will then bring up all of our current offices in the community that are accepting the Ingham Health Plan. If you are not currently established with one of our offices, please choose an office that is labeled Open to All. Once you get to the final steps of your application, this is where applicants will need to begin uploading the documentation to provide proof of their identity, income, and residency. These documents can be in the form of a PDF or as a picture. Applicants must agree to the terms and consents listed here, and they will be reminded of the $20 administrative fee that each of our members is required to pay. This $20 administrative fee is due the month after enrollment and then every year following. The applicant will get an invoice that will be sent separately the month following enrollment. Please allow 3 to 5 business days for applications to be reviewed. If approved, the applicant will get an approval message sent to the email on file with effective date of coverage. New member packets will arrive in the mail within 3 to 5 business days after the application is approved. If denied, applicant will get a letter in the mail stating why they were denied. Pending applications have 2 weeks to complete unfinished application. An email will be sent to the email on file listing documentation needed to process the pending application. Within 3 to 5 business days after being approved for Ingham Health Plan coverage, members will receive their IHP card, welcome letter, and the new member brochure in the mail. As a reminder, your Delta Dental packet and card will be mailed out separately by Delta Dental and typically takes 3 weeks or more to receive in the mail. If a member doesn't receive a Delta Dental card, they must call Delta Dental directly to have one mailed. This wraps up our Ingham Health Plan enrollment presentation. If you need to contact us, you can contact us by phone at the number listed below, email, or visit our website.